Invisalign is one of the services that we offer in our practice. I myself have been providing Invisalign since 2005, and very proud of the fact that here in our practice, between myself and Dr. Dollywall, we've been able to achieve, just by our two dentists in the practice in one office, a Gold Plus level. So it shows our patients that we have experience dealing with different cases. Invisalign is one of the most fun treatments that we can offer for our patients. When I say that, it's fun for us in the office. When someone comes in and we get to do a complimentary digital scan, and that's what we do for our patients here. If someone calls and wants to come in and learn about Invisalign, we book them in for a free digital simulation scan and consultation. And we also have our patients in the practice. All of our new patients get what we call a health scan, and in that health scan, we'll talk to our patients about their teeth and their bite. One of the common questions we get is, who needs Invisalign or who needs orthodontic treatment? There's a number of different cases or conditions that require orthodontic treatment. And orthodontic treatment in the past involved traditional wires and braces. And then Invisalign came about, and it provided a way for us to avoid having to put our patients into metal wires and braces and still be able to do the movements that were required. One of the greatest strengths of Invisalign is that they invest a lot of their own money into R&D, into research. They get so much data over the years from all the cases that they've treated. And that's one of the reasons why Invisalign has become so good at what they do. A lot of other companies have come into the market and over the time, which is like any other service or technology out there. But Invisalign still sets themselves apart with all of the continuing research and development into their products. And every year, their way to move teeth, even the materials that they're using in the plastics to move the teeth, keeps getting better and better. Who needs to be treated? There's so many different cases, anywhere from people with spacing in their teeth to crowding, which is probably one of the most common things we see. Sometimes people's arches, their upper and lower arches, aren't fully developed. They're either narrow or too flared out. Sometimes the jaw growth isn't happening at the right in the right way, and that's one of the things that compared to some of the other companies that are out there, coming in for a professional diagnosis with a dentist or orthodontist is one of the things that's so crucial, because every case is different. If patients agree to having Invisalign treatment, we will then do a complete exam, take x-rays, make sure that all the teeth are healthy enough to be moved. And every treatment is different. Every treatment is customized. And that's why, again, having it done by a professional in a dental office setting is probably one of the most important things that we chat with our patients about. If teeth aren't lining up properly, what that does is it subconsciously forces us to adjust the way that our jaws and teeth then come together. And what that leads to is grinding. There's a lot of talk about grinding and clenching, what leads to it, and stress, is that the main thing? Stress is, grinding is a multifactorial symptom, and that's the other thing that we explain here in our practice, that the grinding and clenching that people experience or exhibit is a symptom. The breaking teeth or the chipping teeth are a symptom. The receding gums are a symptom. The problem is the position or alignment of the teeth and the jaws. And one of the great things, the technology that we have in our practice, we have some digital scanners, the latest iTero 2 scanner that we do our health scans with, and that shows the forces of how the teeth come together, and we're able to show our patients. And it's one thing to tell them. We also take photos, and we have big screens in our practice so that we can show our patients any concerns that we have about their bite. But the technology of the digital scanner is amazing, and being able to show our patients that, hey, you know what, your front teeth shouldn't be hitting together like that, or your bite is asymmetrical. You have a heavy bite on one side and you're almost not touching on the other side. What do you think of that? And then we are able to show them pictures where their teeth have worn down or where there's gum recession, and we're able to tie that in and then educate our patients on what's going on in their mouth, share with them our concerns of what's going on, and then be able to offer them a treatment. And Invisalign is one of the I always tell our patients, it's one of the best things we can do because it's non-invasive. I tell our patients, if we leave things as they are, your gums will continue to recede, and then you'll end up needing to have a gum graft treatment, or you'll chip your teeth, and maybe now you might need a filling. But if we can get to it early and address it with something that's simply by putting these clear trays on your mouth and changing a tray once a week, when patients hear that, we don't even have to really discuss the actual treatment. It's like, our patients are asking us, how can I fix that? How can I fix that? I'm like, okay, this is the solution we have. And Invisalign is great because not only can we do Invisalign on adults, we're doing Invisalign on our teens in their practice, and now Invisalign recently launched their Invisalign for children. And getting involved in kids at an early age is one of the most beneficial things we can do for our kids in guiding their jaw growth. And that's the most important thing, is guiding our young patients' jaw growth. And if we can do that early on, we're just setting them up for a long-term healthy oral cavity, or a situation where they're not going to need lots of invasive dental treatment down the road.